like those are not signs that I'm really calibrating my nervous system. Those are signs that I'm still managing. PTSD is not a resolvable condition. So once diagnosed, you kind of carry it with you across your chart for the rest of your lifetime. And ketamine assisted therapy, particularly the ketamine molecule itself, allows us to go after these two sites in the brain, which basically allow us to pivot our perception.
It's 30 of the hour, and guess what we do? We start on time so that we can end on time because everybody's time is important. I'm Dr. Kelly OMD, your board certified OBGYN and healthcare executive, here to help you live your healthiest and wealthiest life. And the way that we do that is through Viva Life. And Viva Life stands for Live Life, and we want you to live your healthiest and wealthiest life. Spiritually, physically, financially, mentally, and emotionally. And so those are our 5 pillars. And those 5 pillars, the way that we support those 5 pillars is through meditation, journaling, exercise, optimizing our nutrition, hormones, and sleep. But tonight is not about Dr. Kelly OMD. It is about our special guest. And our special guest is Lisa Majunkin. She is here to tell us more about herself, the topic that we're going to discuss, which is ketamine therapy, the 5 W's, and how you can utilize this tool in your toolbox to help you live your healthiest and wealthiest life. Lisa, go ahead, take it away.
All right, y'all. Thank you so much for having me. It's a pleasure to be here. Some of the top, if I was to boil it down, top 3 things that I would hope we can kind of take away from this session is really having a little bit more of an expanded idea when we talk about integrative care, when it involves mental health, what that means, really looking at what are the benefits to me for ketamine assisted therapy or to my community. And then moving from more trauma-informed care to actual trauma recovery approaches and what we mean when we talk about that. So those are kind of some of the main pieces that I'd like to touch base on. In terms of integrative care, I think this word has kind of gone loosely flipped around a fair amount. It's kind of like wellness. Everyone's popping up with wellness centers and things of this nature. It's kind of like when you get told you should do self-care and you're a mom, you're like, yeah, I got that, right? A good idea. I know I should be doing it. It's really hard to kind of connect to on that. And integrative care is really this idea of it's a collaboration of techniques that best work for you, your body, your mind, your nervous system, your soul. And so that might look like a blend of Eastern and Western techniques from a medicine standpoint, or it might look like untraditional approaches, or it might look like really traditional medical approaches. It really just is about how much you are the driver and really understanding what works for your system. How I generally gauge if something's working for your system is usually off of how your nervous system is responding to it. So generally, most of us wake up and the desire our nervous system has is for it to feel really good and calibrated and stabilized and thriving and flowing. And I can knock out all the things I want to do and I have the energy I want to have. And I think a lot of folks, unfortunately, as our lifestyles get really into a lot of multitasking and just the hustle of the day, we kind of get really used to functioning at certain levels and we learn to manage things really well. And that management essentially creates a wear and tear circuit, right? So our nervous system it's a survivalist at its finest. So it can operate at very baseline levels of functioning if we require it to do so. And so really having the skills and the tools and the privilege and the space to be able to learn new resources to really re-expand back outside of just the hustle of daily living is a priority. And I think that fits really well into the 5, essential pillars of life that you all really emphasize here, which is like, how do we recalibrate looking at the whole system versus symptomology? So I could talk forever on integrative care. I know I don't have forever. But I think some of the parts is this part of, I think we have gone just due to how care is doled out and how we receive care is very insurance prescribed care. And there is some benefits of financial coverage for that. And then there's some not benefits of we generally put more energy into researching our next car than we do our next mental health provider or medical.
Don't say that out loud because there's some people in here that really want that next car. But I think you're
And it's great.
absolutely
I
right.
mean, like I'm going to be researching my next card too,
Yeah.
but I think the part is we don't generally vet the people we're working with. We just kind of take what is assigned to us. And I think that is a big part of why integrative care is such an add-on or this extra benefit or this individual person outside your primary care doc or your primary OB/GYN that you're seeing now, or your primary therapist that was a sign that you're like, it's kind of a good fit, but I don't know, we just chat a lot. Like those are not signs that I'm really calibrating my nervous system. Those are signs that I'm still managing. So I think,
And I think
yeah.
that's really important for you to say that, to really understand and define that this is there's some accoutrements that I tell our Viva lifers we don't want to have, if we don't need them, the wheelchair,
Mhm.
the oxygen
Yeah.
mask and all that. However, this is an accoutrement or an integrative approach to your healthcare. We talk about having that circle of love, that circle of care around you, and you want to make sure that you have different subject matter experts on your team that can help take care of you. So let me just like rewind just a little bit. Talk
Yeah.
a little bit about your background, and then we'll go into, what is ketamine and what are the 5 W's surrounding it.
Sure. So, background wise, I'm a licensed marriage and family therapist here in California, and I particularly specialize in working with complex trauma dynamics and complex trauma recovery. So, that's usually multiple incident traumas, PTSD, high levels of dissociation, really intensified or chronic grief. A lot of my folks also really struggle with a lot of co occurring considerations. So, have tried a lot of things. I'm typically seeing someone that's tried all the traditional approaches for 10 plus years and is kind of at the end of their rope of a fair degree of, okay, I guess this is it. I just have to kind of live like this
Mm.
vibe. And so those have traditionally been the folks that I work with. In terms of kind of my history and how I got into the integrative side of things was, I wanted to be a really good student. So I learned all the different techniques, all the evidence-based approaches, EMDR, cognitive processing therapy, everything that's traditionally used for trauma recovery from a Western standpoint that has kind of that gold stamp of approval, that, yes, you are doing trauma recovery or trauma informed care now. And what I kept finding was, no problem with doing assessments, building rapport, understanding clinical landscape. My clients felt heard. They knew that I understood what they were going to. But I couldn't really offer that comprehensive recovery piece, which, trauma is a very interesting beast. I like to say it's different than other mental health considerations in that you need to have alignment and moving of what has been stored that's not working for you in your mind, your body, and then that connection to my sense of purpose again that got disrupted when these events happened or just went unresolved for a long time. So fortunately, this has been even less studied if you are a female, and this is even less studied if you are a person of color, and this is even less studied. There are more rats that have been tested on for medications for PTSD than there are women, where these interventions have been utilized. And the last gold standard intervention or even medication was introduced over a decade ago for PTSD. And I took offense on a part of my clients. Like even in our standard of diagnosing, we use a measure book called the DSM and five. And so in its fifth revision, which is the most current, PTSD is not a resolvable condition. So once diagnosed, you kind of carry it with you across your chart for the rest of your lifetime. And I think that has really carried forward into how providers have thought to treat. It's not about treating it, it's about managing it.
Mm.
And that to me, we are doing a huge disservice to folks when in fact, there's not a generation of humans that have not incurred trauma, period. Like since humans have been on the planet, have had traumatic events happen to them. And whoever made us and designed us also gave us a nervous system and a grief and loss cycle to be able to move traumatic energy. And so when something is getting stuck, the idea is there's places here for us to look at what we can do with that. Why is it getting stuck? Because the reality is you can take 100 people, put them unfortunately through the same traumatic event, and science shows that maybe between 5 to 20% of those folks will develop PTSD. And so the question has always been, well, what makes all the other folks more resilient than these folks? Like, what is that factor? Millions and billions of dollars have been spent to create military units and special operators and folks to be able to learn how to be resilient in the face of trauma. And what, traditionally what it continues to land in is how well your nervous system is recalibrating, but also your sense of perception to the event is how did it play a role in comparison to kind of your story about living. So if I have a traumatic event, let's say a car accident, for example, and it's a single incident car accident, I'm usually going to compare it to like, well, I've been driving for a good deal of time. This happens at times. That was really intense, but you know what? Like, I've got a good support. I need to start driving again. Let's try this. Maybe I can bring someone with me and do that. If I have a chronic history of car accidents, my narrative and my life story at that time is like, this always happens to me. The world is unsafe. People are unsafe. No one can be trusted. No one knows how to drive, all those type of things. And this event, instead of it becoming an event that I challenge and grow from, becomes an event that feeds that narrative. And so that's kind of the resiliency factor component. So what had me start to think about this was this factor of if a lot of Western approaches are really good at getting to the narrative. We understand how the trauma got there. We understand the development of it. We understand family lineage stuff. We kind of look at those areas really well across a lot of Western therapy modalities. The area that is not well attended to is the body and the integration that the body, which is like, if you look at like the head from the rest of the body, the head's like a third. The body is the rest of the 2/3 of the machine. If 2/3 of the machine is storing traumatic energy from time of incident or from event or has learned to disassociate, you're not actually moving any of that energy across the body. And so what I would typically find was folks would do really well for about 3 to 6 months post a treatment series of traditional EMDR or cognitive processing therapy if they happen to make it in. And then slowly but surely, they'd start coming back because an unforeseeable event or a broadside, what I like to call an act of betrayal or an act of sudden, like, whoa, what was that? Happened. And their body had the same visceral reaction that it had before. And the body then flooded the brain with all the original thoughts that it had. And it just caused this circuit loop of like, see, it's not gone. See, it's not. So no matter brain, how much you rehearse it, I'm holding this. This is something that I'm just going to have forever.
And I think that, let me just put a pin
Yeah.
right there. So when I think of when you mentioned the different traumas
Mm-hmm.
that people are having and experiencing, and considering that we're talking mainly to women, and many times we're talking
Mm-hmm.
to women of color on this
Of course.
platform, at least, that's a lot of traumas, right?
It's a
So we
lot of
talk
trauma.
about the adverse
Yeah.
childhood experiences. We talk about if somebody's had intimate partner violence, anytime in their life, whether that be, rape, molestation, domestic
Mm-hmm.
violence, between partners, friends, close people. Then we talk about the traumas that people experience, maybe around surrounding birth, right? So
Yeah.
natal trauma, and people really don't think about PTSD from having a
No.
child many times,
Yeah.
or losing a child, right? Whether that was in
Yeah.
your womb,
Very much
soon
so.
after delivery, or later on in life when they're still young. Nobody wants to have, lose their child before they actually
Mm-hmm.
pass away. And then there's multiple work traumas, family trauma. There's so many things that people are piling on and on and on, and they're being told to be a super person and that they're
Mm-hmm.
supposed to be out here and they're still supposed to be resilient. And a lot of people have come to me and be
Yeah.
like, you know what? I grew up with all of these things. I am resilient. I don't need anybody else to teach me more
Yeah.
resilience. What I need
Yeah.
is better tools and treatments so that I'm
Mm-hmm.
not just managing, but I can thrive in my lifetime. So
Yeah.
back to you on that.
Yeah. And I think, a simple test is like if everyone in the audience for a minute just took a moment and just take an exhale, regular exhale for you. And then on your next one, I'd like you to notice how far down your lung capacity does your exhale come to.
Mm.
I've had a full day. I've been hustling. I'm a little nervous. I talked to Dr. Kelly O. It's kind of a big deal, and it's like I can just feel like my breath is resting here. And this is maybe like a third of my lung capacity. Right. And so this is a classic sign for me to know that my body is anxious. And it's not necessarily bad anxiety. I should come here with some energy. You all deserve that. You've tuned in, right? But I think this part is what it is a sign, though. If I keep breathing from here, it's keeping me revved at a higher pace every day. And these are techniques that are somatic based, and somatic is just the word for body, and body based techniques and understanding that and involving what's called biofeedback, me actually taking a moment I breathe automatically. So I don't consider how far down I'm breathing unless I attend to it consciously. And the breath is one of the few tools and techniques that we have that one is that we can control voluntary and involuntary. So as soon as you're not trying to attune to your breath, your body takes back over, which is really helpful because if I had to tell myself to breathe all day long, that would be rough. But I think this part is this is like one of those tools that is basic evolutionary for us that is free. We can do this. We can tune in. I'm even no matter how busy we are, we still got to drive a car, take a shower, do these type of things where the goal is not adding more to the plate. The goal is integrating these skills into your already daily life. Most of us are already attuned to certain things, music, sound, nature, light, feet on the earth, those type of things that automatically just make us take a deeper breath.
Mm.
Right. So for me, if you put me next to any tree or something like that, or a dog or, a fur baby of some type, like you just watch me like, wow, like
Mhm.
I just take a deeper breath.
Right.
And I think this is where, this idea that doing trauma recovery work and nervous system regulation work is all clinical. Like you need to get in and you need to see someone and do so face to face versus like, since people have been healing for a millennia before all these therapy approaches approached, what did they do? They connected to the earth, they connected to their breath, they connected to the vision of their life that they want, connect to their people, they connect to storytelling. They found purpose in the work that they were doing. That is inherently how trauma is not meant to be a stagnant thing that comes in. It is a thing that we have to face in human form. So it's as hard as this is because the individualization of the trauma is what makes it unique to us. But the body processing trauma is not unique. It is very mammalian. And when trauma gets stuck, the brain doesn't like things that are stuck. And so as soon as you get some downtime, it wants to go there and it wants to review it and it wants to go over and over and over it. And so learning techniques that are really based on being able to register where am I at right now is the real powerful piece of this.
And I think that, that's the part that we get to probably before and while we're going through this therapy that we're going to speak of over the next few minutes in regards to the ketamine. But you're so right. And, when I think about it, we have one of our Viva lifers helps you move through like natural places like forest walking,
Yeah.
right? And we
Yeah.
did that and we were able to do it virtually and we've done it face to face. And I mean,
Mhm.
just going outside and putting your feet on the ground, not your shoes,
Huge.
your feet
Yeah.
on the ground, right?
Yeah.
Whether that be grass or,
Mhm.
soil, something like that. But then you talk about being able to hug somebody, being in community, getting that hug or a kiss. I mean, that is just oxytocin dripping. And that's one of the things we focus on. I'm like, we need to make sure the oxytocin is dripping through our body
Yeah.
because that is the pleasure, the happiness, the rest, the
Yeah.
relaxation that people actually can utilize that as a natural hormone in
Mhm.
their body. So, why don't you tell us about ketamine therapy and how this can be or should be included into our experience?
Yeah. So, ketamine assisted therapy, traditionally, ketamine therapy was primarily used as an anesthetic, was really found during field medicine and combat to really help folks be able to withstand both pain management and receive the initial anesthetic that they needed in the field to have procedures done, particularly while at war and stuff of that nature. Ketamine does not cause the same degrees of cardiac depression, which means it doesn't put as much strain on your heart, plays really well with other medications in the field. And so, pretty much for all of us who have received any type of inpatient or outpatient surgery, we have also been administered ketamine as a part of our anesthetic because it's just a lot safer to utilize. About 15, 20 years ago, there became an increased interest in how this could actually be utilized, cross-laterally into mental health spheres. Kind of found out rather haphazardly. So folks coming out of anesthetic who were receiving ketamine instead of higher degrees of morphine at the time started to report increased mood elevation and decreased depression symptoms and stuff like that. And caught enough attention of the community to say, like, we need to look into this. What is happening here? What is going on? So really it has been used much longer, but for the better part of the last 15, it has really entered a much more mainstream stage of being considered a potential treatment and really got kind of most of its promotion and the studies that were done more consistently have been going after what's called treatment resistant depression, which again, this is like PTSD with unresolved parameters, right? It's like you have basically exhausted everything science has to offer you. And so you are now resistant from a medication standpoint. And that might be because you don't tolerate the medication. That might be because the medication is not effective enough for us. Again, as I said earlier, there's not enough of us of color. There's not enough women. There's not enough like people of very different body mass indexes that have been studied on all these medications. So generally, we're in a comparison pool of our Caucasian male peers to dictate whether this medication is going to work for us. And if you've ever met a woman that's, in perimenopause to menopause, she'll tell you her body is very different than it was 15, 20 years ago. And so, all of this to say is this part of if you've hit a place of like traditional medications are not working for you and you are done with managing certain considerations, ketamine assisted therapy might be a helpful tool to help leverage some of what you're already working on. So it is it's not technically a psychedelic as the other psychedelics, but we treat it within the same class. It is a Scheduled C substance, so it is a controlled substance that needs to be prescribed and watched. It does have some addiction potential, but very mild in comparison to some of the others when taken at the doses that we are prescribing at a clinical level. So for everyone, I think people are like, what? I'm not doing ketamine. Are you sure? Like, what is about
Well,
to happen here?
when I think about it, I think about like propofol, right? And I'm like, oh,
Yeah, like people are like,
and
oh, we're going
it
to a
depends
rave.
on
Yeah,
how much
yeah.
into music you are. You remember the whole propofol issue. So,
Yeah, right. So this is a very different vibe of what we're going for. So we're going for subclinical doses. So we're talking like a fraction of a dose that you would give a newborn in the ER for a procedure. And there's, kind of a spectrum of difference. So the subclinical dose is enough where you feel slightly disassociated from your body in terms of like you're aware that you're in the room, but you might not be aware where like your hand kind of stops and the chair begins for a hot minute and part of it. But if I needed to get up and move around, I could if I need to. If I need to advocate, I can. I can articulate myself. I think that that is particularly being a female and working with a lot of trauma was a big concern that I had with working with this was like, would this cause more trauma if the person felt like they couldn't, advocate for themselves? And I've really found a huge benefit that in ketamine, there's actually an increased ability to advocate for oneself because some of the things that often we don't speak up about or connect to on or say or express because we're worried about how it'll be perceived by our providers, that wall is kind of down a little bit. And that's really big. The dosage that we're going for is what's called a therapeutic working dose. And so the way I like to think about ketamine is ketamine should not be a standalone intervention for mental health reasons or even just for chronic pain by itself. It should be something that you're doing in conjunct to meet you where on the work you are already doing. So I like to think of we talk about this here at Daydream that ketamine is basically these treatments are increasing what's called the window of transformation. And the way that it does it is it's going after GABA receptors, and those are particularly found in your frontal lobe. So, which is our higher order reasoning. And it's the part that has all of our like, okay, I should be doing this. This makes sense. Let's do this. And so opening up neural networks that might be traditionally kind of not receiving much activity. And neuroplasticity is the ability of me to learn new things and acquire new knowledge and open new channels. So ketamine therapy particularly targets that part of the brain. The other part of the brain that's most useful for trauma recovery and chronic depression and chronic anxiety and OCD and chronic pain states is the amygdala, which is this little almond-shaped nugget attached to our hindbrain. It's called our reptilian brain, which its whole job is to scan for stuff to be scared of. It's like, is this going to cause me harm? And so oftentimes for a lot of folks that I work with, this is an overactivated center. So earlier we talked about that, particularly in the population that might be listening to this right now, is the understanding that I might come from a lot of events where trauma is there. And what that means is that my amygdala might be firing more than the person next to me. And that might interfere with my ability to kind of connect to this higher order reasoning. Or I know I shouldn't be freaked out about this, but my automatic reaction is that I'm reeling through the roof right now and what that looks like. And so ketamine assisted therapy, particularly the ketamine molecule itself, allows us to go after these two sites in the brain, which basically allow us to pivot our perception in a single session. And I think there's a high usefulness of being able to have a tool that helps me expand my neural networks and expand how I'm looking at something. So it doesn't make you forget what you came in for. It doesn't make you it doesn't vanish it. It's not hypnotism, but it essentially broadens the perspective of how else can I look at this? And is there, is there something that I'm kind of leaving out in the picture here? And I'm not having to argue with myself as much in navigating that. And so that's where I see a huge potential benefit for considering this as a potential treatment approach for many people.
Absolutely. And like I said, this is a huge topic. And number one, thank you
Mhm.
so much for coming on and explaining us like down to the basic as possible, because many people have not heard about it
Yeah,
or heard about it to the extent that we have presented
yeah.
it here today. So if anybody has any questions, you can raise your hand, put it in the chat. Let us know, thumbs up or down. Have you
Mhm.
ever heard of ketamine therapy before? And if you have any questions about ketamine therapy, then please, by all means, ask the questions. I do have a couple of just to start us off with this. So I know you mentioned your company, so I got a couple of
Mhm.
thumbs up. I know you
Yeah.
mentioned your company, so tell me the name of your company and you know, what would it be like for me to contact you? And then what should I expect walking through the door? Like, what are you
Yeah.
going to ask me?
Mhm. Of course. So every ketamine clinic is a little bit different. There's a good handful of them across San Diego County. We are located right in Scripps Ranch in San Diego. So it's called Daydream MD. It's an integrative health and wellness center. We offer kind of a myriad of services. So ketamine assisted therapy is one of 5 service lines that we offer here. We do executive coaching, functional medicine, traditional psychiatry, expanded and integrative trauma recovery therapy, also insurance covered therapy. So we are offering kind of the gamut. Because of that, we have a really beautiful wellness care team who can answer any questions that you have. We have a really thorough website with so much information. Y'all, I've spent hours trying to build this website and maneuver through and create a way where all the information is accessible for all the questions that are asked and answered. You can download from our website. It's called it's a free ketamine guide that allows you to kind of walk through what this is like and looks like. And we have a really growing amount of blog articles as well as social media posts to really help people understand what this looks like. So traditionally, for someone coming in, we would recommend an individual infusion, and this is an IV ketamine service, which would allow you to be able to understand how your body works with the medicine, one-to-one care with one of our expert trained ketamine nurses. You would start out with an initial medical consultation to just make sure that this is an appropriate level of care for you and this makes sense, and to kind of walk you through all the questions that you have. I highly recommend that these services are paired with an integration and preparation degree for this. So, working with someone that works with this medicine and really understands kind of, we're not tackling all the things of life. It's like, what is if you were to think of one area of life that that if you pivoted would create some of the best benefit for you right now, what would that be? And kind of really looking at, okay, well, tell me what's getting in the way of getting there, because you can clearly tell me what it is, so you know where it's at, like what's interrupting this, and where is that stored in the body. Okay, can we do some exercises to see how you organically move that? And then bringing intention really into the ketamine session is a huge piece. So because we are all adults, I like to start intentions with I choose, because if I don't choose to move something, it's not moving, no matter if I think it should or whatnot. And so it's this very intentional based thing of saying, I'm done with this chapter now. I want to move to this chapter. It is time. I am moving. So whether I do ketamine, like moving is happening. This is non-negotiable. So really getting back to that self-empowerment, self-resolve of like, I got one lifetime. What do I want to do with it? And the story, I might not have been able to pick or have influence on the traumas that have happened to me, but I most certainly get to pick how this next chapter rolls out, and what I'm doing with it.
And then how many treatments do most people, I mean, I know
Yeah.
everybody's different, but how many
Everyone
treatments
is
are most
different. So
people do?
generally to see the benefit, what we can most tell from science, and this is what I generally see here, it really degrees on severity of mental health and where that's at. So if someone is really grappling with very deep depression, maybe not wanting to be on the planet, that type of stuff, that is the traditional treatment method of having 6 treatments within 2 or 3 weeks. And that is really to create a really sizable pivot. And again, y'all, traditional psychotropic meds take at least 2 weeks to show a baseline effect of how well they are doing. So we're trying to do a great deal of work in a very short period of time because it's time sensitive. If someone's possibly contemplating not being here, then we only have, we got to we got to be effective very quickly. And so that is a more intensive protocol. The protocol that I most often see is for folks that are generally doing well, living life, they're managing carpool, they're just trying to do the things, but they don't want to have to manage themselves so much. They want to kind of have a better lift of anxiety and depression. And so that might be something like 9 to 12 treatments over a period of 6 months. Traditionally, we start with one, see how you react. We try to do 3 in kind of a succinct period of time. So maybe 1 a week or 2 in 1 week and then 1, because that creates the broadest range of this neuroplasticity. It feeds off of one session to the other. So traditionally, the neuroplasticity window would be about 30 days, but that really depends on how intense your lifestyle is when you leave the clinic. So if I'm running back from this, back into my household, back into my life, back into running businesses, back into all that, my window is going to be shortened because my bandwidth is shortened. And so, but I think really understanding that this is also a potential benefit of where I could use ketamine assisted therapy strategically for what we would call tune-ups. In areas when I know, man, this time of year is really rough. I got some anniversary dates. This is when a lot of stuff I just don't do this season. That type of stuff is we don't need to wait till we're in the bottom of the well. We can start to kind of pull up now, and where that's at. And then the third one is much more for folks that I would say are like single incident hits, like they're going through a phase of life. We're talking menopause, perimenopause, divorce, grief and loss, those type of things. And they just need kind of a couple of sessions to really just tune up and see how they can pivot out of this spot, or to just get some lightness in while they're working through some of the heaviness.
Well, I think you just described 3, different, I guess, case scenarios, personalities, experiences that really actually hit home for many people that are listening to this and will listen to the future. So I am so grateful for you to really break this down for me, because now I can, say we have this resource, or I know the person that has this resource, and here is the video so that you can understand it better, and an amazing website so that you can understand it even more. So we're going to help you by dropping the link in the chat in regards to how to get in touch with you. But just tell us out loud how to get in touch with you, where you're located.
So if feel free to
from out of town, is there anything you can offer them in case?
Absolutely. So in terms of consultation on this, say you're wanting to look into this, but maybe you want to vet the clinic near you and you might want to know what I need to ask for, or things I should consider, or is this even a right modality for us? Call us. We're happy to connect, educate, spread the word of where that's at. Again, truly believe in vetting our providers. You can find us at www.daydreammd.com, or you can follow us on social, day_dreammd, for all types of videos and all that. So,
awesome. Well, thank you so much for being here. Thank you for enlightening us.
Thank you.
The audience is quiet because this is a lot.
I'm so sorry, you guys. I know. I just come in here and I just launch.
No, but you're passionate. You're a subject matter expert in your field, and you're here to help. And that's why we brought you on today, because when I met you, I was like, oh, she is the real deal, and she is really trying to not just help you survive, but to thrive. So that being said, everybody, thank you so much for coming on. As mentioned, we have Lisa Majunkin here. She's already given you her information about how to get in contact with her. And I'm Dr. Kelly, OMD, your board certified OBGYN and healthcare executive, here to help you live your healthiest and wealthiest life. So please follow us on all our social. You can find us at drkellyomd.com, and click all the links because they're all there. Have a wonderful day, and don't forget to do what? Viva life.
Thank you, everyone.
All right. Thank you for being a part of the Viva Life experience. I'm Dr. Kelly OMD, board certified OBGYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva life.